So what they said was that women that have hot flashes, particularly early in menopause and actually before they fully become menopausal, those women tended to have more abnormal flow-mediated dilatation. What that means is that surrogate marker has been linked to more cardiovascular events long-term. So what is important is to recognize, first of all, heart disease is the #1 killer for both men and women, and that when women have these symptoms going into menopause, it's something that they should at least talk to their doctor about, because it might indicate that they are more at risk for heart disease down the road. So I don't think somebody should be fearful that I'm having a hot flash, that means I'm going to have a heart attack. I think it tells us that that woman's arteries may be responding differently as she's going through menopause. And that's what this FMD, this flow-mediated dilatation, is an assessment of. It's really telling us that the arteries aren't working quite normally. That's more common in women who are menopausal anyway. I think the issue is that as a woman gets older, the other standard cardiovascular risk becomes more prevalent, so that the hot flashes as an independent thing isn't as strong. So when you're younger, you don't have those other risk factors maybe as prevalent, abnormal cholesterol, high blood pressure, those things, so that those hot flashes may be an early marker that something's going to happen or something is wrong. And then later in life, when you're fully menopausal, that may not be as much of an impact because the other risk factors sort of become more prevalent. It doesn't seem to be directly related to estrogen levels, which is the study actually also mentioned. So we don't know exactly what's happening, but there's something happening in a neurotransmitter in the brain. So we don't really know what it is. So when we don't know what it is, how we help it is unclear. And the question is, by treating hot flashes, do you improve any of these? And that no study has really looked at that if you treat hot flashes with hormone therapy or some other medication, do you change the way the arteries look or act?